everyone, welcome to iAfrica Media, the biggest media platform for all things eye care on the African continent. It's been over a year now, like close to 2 years with this journey of iAfrica Media, and one thing that has been the most dominant aspect of what we do as iAfrica Media is the unity between the different professions within the eye care community. Seeing ophthalmologists come together, seeing optometrists come together, optical dispensers and the greater community at large. Today, we've got this amazing privilege and the opportunity to be sitting across one of my heroes, actually. He has never heard me say this to him, but you truly inspire me, Dr. Dylan Joseph. Your passion for eye care, your resilience, your relentless pursuit of excellence within the profession, you have taken things to a whole different ballgame. We've got some scans here, everyone. Yes. I know I can go on and on about talking about Dr. Dylan Joseph, but these are actually my scans.
These are OB scans.
Should I do Lasik or shouldn't I? And we've just done a complete workup. That's my eye that you're looking at. We're going to go through my scans to figure out what is the status of my vision, what is the status of my eye, and do I even qualify to have Lasik done? So Dr. Joseph, please talk me through it. Well, what are we looking at? What's the setup?
Okay, so obviously what we're going to do is run through the images from the back of the eye right to the front. And in terms of determining candidacy, that is what the goal of this is. But what is really important for you, as it is for anyone looking for vision correction options, is you've got to answer two questions. One, do I want to improve my vision quality, and is that going to improve my quality of life?
Sure.
And secondly, do I want to reduce my dependence on contact lenses and or spectacles and or reading glasses, or a combination of the above? And if you can answer those two, then that's when you're sitting in that chair, when you're sitting right there. But so Obi, this is the back of your eye. This is your right eye. Okay. Fundus image. Here we've got your optic nerve, which is an extension of the brain. And in your case, that optic nerve is very normal, very healthy. Your blood vessels, your veins and your arteries, they look very healthy caliber, very normal. This darker orange spot over there is called the macula. The macula controls central vision, so fine detail, reading and writing. That looks very normal, and in your left eye, those structures are normal. But what we do is take a high resolution scan, or the OCT scan, as you know, through the macula. We turn it on its side, we examine the 10 layers of that retina to make sure that to the 1,000th of a millimeter that area is normal.
Okay.
And this is the resolution that we get on the OCT scan of your macula. So that little dip there in the middle is called the fovea. That's your real central fine vision. That looks normal, and in your right eye that looks normal.
Wow.
You might notice this little faint line on the top of the retinal surface here.
Yes.
That's the posterior hyaloid, or the vitreous, the gel. It is still very firmly intact to the back lining of your retina, both the left and your right eye. But within the gel, you can see on the infrared image here, you've got tiny little dots, and those are floaters. So floaters they move around in the jelly of the eye. You may notice them against a brightly illuminated sky or a white wall, but they're nothing to worry about. So if we then move to the structure in front of the jelly of the eye, we on this sagittal section, we get the structure called the human lens. Now there's your human lens, okay? Now that human lens, in your case, is nice and clear. So with your spectacles on, it allows the light rays to travel through the cornea, through the lens, to make a nice clear image at the back of your eye. These muscles over here, they're still functioning really nicely for you, so you can change the shape of your lens. But when you get to my age, and a little older, presbyopia sets in, right? So it's the short arm syndrome. So when you start moving the page a little further away from yourself. But for now, you're still going to have the longevity out of correcting your distance vision, and still be able to read. But when that happens, we cross that bridge, okay? We're going to turn our attention to the structure in the front of the eye. That's called the cornea. And the cornea is the structure that we change the shape of with laser vision correction. So we've got to determine, are you a healthy candidate for laser vision correction? When we look at the corneal scan, we look at something called the Topography and Tomography Map. So it's elevation maps, lay of the land. This is your right eye, and you're sitting in a helicopter looking out onto Table Mountain. Where is it steep and where is it flat? And in topography and tomography, the warmer colors indicate steeper parts and the cooler colors are the flatter. That's your right eye, and this is your left eye.
So it's looking good.
It's looking good. The topography is looking good. The tomography is looking good. Tomography meaning we're looking at the a best fit sphere on the front surface and a best fit sphere on the back surface. So in layman's terms, if you took a sphere and you put it onto the anterior surface of the cornea, the parts of the cornea that stick above the best fit sphere will come up as warmer colours, and the parts that are below that best fit sphere are the cooler colours. And that's really important, especially on the back surface of the cornea, because that gives us an idea as to whether architecturally that cornea is safe, or is there perhaps a history of formed thrust keratoconus, subclinical keratoconus, or is there frank keratoconus? And that gives us an indication as to whether or not we can do a procedure on the cornea. This is a graph I use a lot. It's called the Benign Ambrosia display, and basically it takes a number of different points on the cornea and relates it to a database against normative eyes and abnormal eyes, and says, well, is your cornea structurally sound for laser vision correction? And basically what these scans are telling me is it is. However, as a refractive surgeon, it's really important to go and look at the top 50,000ths of a millimeter of your cornea, and that's this bottom left shot over here. That's called the epithelium. Now, the epithelium in your case is very normal and very healthy in both your right and your left eye. And so we know that your cornea is now structurally sound and can withstand laser vision correction. And on top of the cornea, we look at even more detail, because your tear film is really important for good quality vision and to lubricate the eye so you don't feel symptoms of dry eye. This is a high resolution scan of your tears in your left eye. Green means healthy and normal, and in your right eye, green means healthy and normal. So can you have laser vision correction? Yes. Can you have Lasik? Yes. So with regards to Lasik, we don't use blades, we don't have knives, there's no needles. We have two laser vision correction systems. The one's called the Femtosecond Laser, the other is called Eczema Laser.
Okay.
So on the day of the surgery, you sit with me in the preoperative chat room, we talk you through the whole procedure. So you know exactly what stage of the procedure, what's going to happen, and that you are feeling confident and comfortable.
Okay.
We give you an Valium to relax you, we put anesthetic drops in your eyes and antibiotic drops. A lot of people panic about how they're going to keep their eyes open during the procedure. You really don't have to. We put a little speculum in between your eyelids. It separates the eyelids for us to hold your eyes open. And with lots of numbing drops on the surface of the eye, we put the first laser system onto your eye, and that's the femtosecond laser. Now the femtosecond drives pulses of air or gas, which creates plasma in the cornea, and those gas bubbles actually separate the tissue. It doesn't cut it, it doesn't split it. It just separates the tissue at a predetermined plane and a depth. We can do it so accurately with a femtosecond, 120 mils on a 5 mil hinge. We then lift that hinge out the way, which exposes your underlying cornea. We then move you to the second laser system, which is the eczema laser, and we've got your own customized, personalized data pulled in to this eczema laser. So we'll only recognize you. And we reshape your cornea. We take out your short-sightedness, your astigmatism, and at the end of the procedure, we then take that flap, we put it back into its place, and we smooth it out. We are in the post-op lounge for 20 minutes, and then we review that flap again, make sure I'm happy with it. So why Lasik? Lasik is a very quick visual recovery. Within 4 to 6 days, you're seeing what your contact lenses or spectacles gave you, if not better. And secondly, there is minimal discomfort. It's the first 2 to 3 hours which can be quite tricky, and after 24 hours, you're pretty much up and running. Risk profile of Lasik. Your biggest risk is with astigmatism is a need for a touch-up or an enhancement. What does that mean? The eye remodels, the epithelium remodels, and wants to take you back to where you were. Not because the laser fails, it's because of your remodeling.
Okay.
And astigmatism carries one of those high risks in the magnitude of 10 to 20%. So if it was within 2 years that you needed a touch-up, you could lift the flap, repeat the laser, put the flap back down.
Okay.
If it is after 2 years, I don't lift the flap, I don't cut a new flap, we laser on top of the flap. So we do a surface treatment. It's a longer visual recovery, but we do at the end of the day what is safest for your eye. So when we know that that's the biggest risk, but we can manage it, it reduces that risk profile significantly. Infection and inflammation, 1 in 10,000. It's always under that flap. If it occurs, we lift the flap, we rinse it out, increase antibiotics and anti-inflammatories, and you usually do very well. Dry eyes, it's transient. If it does happen as a result of laser, we increase anti-inflammatory drops and lubricant drops, and You usually do very well with that. Flap complications is exceptionally rare. We're talking less than 0.1%. It's gas, it's plasma. So if there was an issue that I wasn't happy with, I'd say to you, Obi, listen, I'm not going to go on with the laser procedure. That gas dissolves, it has zero impact on your vision, but we can talk about a procedure at a later stage. Ectasia. What is ectasia? Ectasia, if you're doing laser, you are removing scaffolding, you're removing bonds of tissue, corneal tissue. Ectasia is the point at which too much scaffolding is removed and that cornea can change shape, which can impact vision. But I wouldn't be talking to you about Lasik if I didn't think you were a good candidate for it. We'd be talking about a surface procedure or perhaps a plantable contact lens or something else. But that is also a really, really rare percentage, especially in a cornea that looks as sound as yours, less than 1%. But in the case it does happen, we pick that up at your scans, 6 weeks, 6 months, 1 year, and annually. And you can do a procedure called cross-linking, which stabilizes those bonds before it changes shape and vision. So, majority of those are manageable, but at the end of the day, you've got to weigh up a risk-benefit ratio and say, right, do I want to improve the quality of my vision? Is that going to improve my life? And do I want to reduce spectacle dependence? And that's basic. Any questions from your side?
Wow. Firstly, I love the fact that you're going through the whole list of procedures that we're doing that enable you to determine what the way forward is. Then the second component of it is the educational component, where you are actually educating me to make sure that I fully understand what's going on with my eye. Am I a candidate or not? What are the possible solutions that are available in managing my needs?
Exactly.
And I think for the people that are watching now, all the optometrists, always remember that when that patient is sitting in front of you, we have to present that patient with the best possible solutions that are out there, that are available. Listen to the patients, be able to determine what is it that the person actually wants. A lot of our patients come into our practices because they cannot see, but actually they don't want to also wear glasses. There are options available. The technology, I believe, has advanced from when I was still a student to what is possible in today's world. And so, as optometrists, we have an ethical responsibility, a moral obligation to be able to be in a position where we are fully aware of what ophthalmologists are doing in terms of the management solutions that they are providing for their patients. Their patients start with us as the optometrists. So it's very, very important that we know the procedures, we know what's the latest technology that's available, we know the latest advancements, so that we can be able to present the adequate solutions to our patients, so that our patients are making informed decisions. Just like I'm making my own informed decision today. Before I can recommend people to do other things, I'm now in a position where I know I also want to own my vision. And from an African media point of view, we are here to serve the eye care community. When we're sitting with the dispenser is going to tell us all the things that he or she does in elevating the profession to take it to the next level. When you sit with an optometrist, the optometrist will give you the case in point as to why spectacles or contact lenses are the best for patients. And today, we are sitting with Dr. Dylan Joseph, representing ophthalmologists, and he's going to communicate from the perspective and the point of view of an ophthalmologist. All three are necessary. All three are important in taking the eye care industry to the next level. So let's work together. Let's inspire one another. Let's learn from one another, because by so doing, we're going to be able to take this profession to a whole nother level. And when we do that, patients are going to benefit. Patients are going to be at the receiving end of that unity, that working together that is possible in the industry. I'm excited for this because I'm going to go into a different trajectory of my life now. I've been wearing spectacles since 2006. I love spectacles, but at the same time, I know that there's more. I know that as an optometrist myself, I know the benefits that exist as well in me not wearing spectacles. So this new journey of Lasik, I'm excited about it. Patients that are watching this, it doesn't matter if you have any type of uncertainty in terms of your prescription, get in touch with your ophthalmologist, connect with Dr. Dylan Joseph, because there is a wide range of prescriptions that we thought are not able to perform Lasik and to treat. But the technology has advanced to such a high level that I'm sure right now you guys have a wide spectrum of prescriptions that you guys are able to do.
So you did right. I mean, I think a point to know though is that we need options, whether it's a contact, a spec, a laser vision correction or an implantable contact lens, it's just to put those options on the table for patients between optometrists, and refractive surgeons.
Absolutely.
And secondly, you're right. I mean, with regards to scripts, the current laser platforms, most of them can laser up to a +6 on the hyperopic side.
Wow.
And then if you're a good candidate to a -12, you can consider Lasik if you've got really good, thick, healthy cornea. But last week I did an implantable contact lens for a patient who was -16.
Sure.
So she can't have laser vision correction, not even surface treatment, it's just too high. And so, she thought she was out of options. And that's life-changing.
Wow.
You're putting that script inside the eye, and you're able to surf again,
Wow.
to go to the
Wow.
beach,
Wow.
to swim without worrying about, where the beach is because you can't see it.
What about astigmatism? What is the limit
Correct.
with regards to astigmatism?
Great question. So, normal astigmatism or regular astigmatism, where there's no tomographic or topographic signs of abnormality or the epithelium is normal, up to -6 diopters of astigmatism. So, we can have a +6, -6 treatment. We can have a -6, -4 treatment. And if that cornea is healthy and if you're a good candidate for LASIK, you can still do that.
Wow.
It's just about knowing what your safety nets are, what your safety limits are, and taking a thorough detailed history and a thorough detailed evaluation of the patient, and then sitting and discussing that journey together. Knowing that, are you going to have enough safe tissue afterwards? And if you do need a second or third procedure, because remember I said astigmatism is one of those refractive areas that require a higher risk of a touch-up or enhancement, are you going to have enough tissue to work with after that? So also in the back of your head as the refractive surgeon, you've got to say, well, yes, I could maybe do laser as a primary procedure, but would the patient benefit more from an implantable contact lens if they're looking for a surgical solution, and then do a laser at a later stage as a top-up? Because then you're not removing as much tissue. So it's all about understanding your patient's needs, the visual demands, your age of the person as well, showing them those options, and at the end of the day, in the majority of cases, we can find you a solution.
I have got no issues with dry eye.
No, you don't, sir. No, I showed you those scans there of your tear film, those 2 scans.
So I'm good to go.
So you're good to go.
Look, thank you so much, Dr. Dylan. This is life-changing. If you're not connected with Dr. Dylan Joseph yet, make sure to check him out across all different social media platforms. From a media point of view, I think this is a topic for another day, but you're on another level. We're on another level. The commitment, the dedication, the consistency in terms of how you're handling your media side of things. I think that's a whole webinar that you have to do. But guys, this was another great interview, a great opportunity that we got to represent Africa Media and talk to an ophthalmologist by the extraordinary Dr. Dylan Joseph. Connect with Africa Media. We are on all different platforms. Subscribe to our YouTube channel. And 2022 is going to be an extraordinary year for the eye care industry, for the eye care community at large, here on Africa Media and on the rest of the continent. Take care, everyone.
Yeah.
Thanks, man.